you look at the some part of the fetus. Remember, your focus is only for that part of the fetus. Supposing I am looking at the fetal hand, or I am looking at the fetal heart, or I am looking at the entire fetal pole. I am not interested in what's happening in other areas. I am interested only in the fetal pole. So the image must be zoomed as much as possible. Make it as big as possible on the screen, then interpretation becomes very easy. If you start looking at very tiny images, then you are more likely to miss things. Because we have a tendency to see, I want a global picture, I want to see where the fundus is, then I want to see the sac, then I want to interpret what's inside the sac. Not necessarily. We've already seen where the fundus and sac is. Now we're interested in what's inside the sac. Just zoom up that area alone. You will see. I'll show you the power of zooming. And please liberally use the zoom function on the machine so that you really see well.
One thing. I had a patient recently. He treated for infertility with IUI, previous 2 abortions. Now this time at infertility patient treated, previous 2 abortions. And this time at 7th week, absolutely no chorionic fluid. The sac inside which tightly the fetus is packed. I was a little worried about it. As I said, the cardiac activity was good. But still, continuous scan now, she is around 20 weeks. Now it has grown well. So it's not that much alarming.
It only means those patients need to be watched a little more closely. And once you reach the 20-week scan and you find that you have done a detailed anatomy scan, nothing is wrong, the growth is all right, forget about what happened in the first time. After that, you don't need to worry. Because if a fetus crosses the first trimester, the chances it will miscarry are very low. Now we can see an early pregnancy scan here. As are you able to hear me there? Okay, Vidya, are you able to hear me? Okay. So what I want you to do is you can see the fetus with the cardiac activity, and you can see you can see the umbilical cord just coming out of that. Maybe there's a physiological outflow seal there. And she's trying to put the M mode to look at the cardiac there. So you can find out these are the heartbeats. You can freeze and take a measurement of the heartbeat here. You can see these two are 1, 2, 3 beats are seen here. So once you're able to see that.
Hello sir, we are here. We have got a patient who's 8 to 9 weeks according to the gestational age.
178.
Yeah, and here I have got Arun scanning for you. Yeah, you can see the heart rate racing which is doing now.
Yeah. So we've taken the heart rate. Now what I want you to do is, this is the trans-abdominal scan. You can see a little bit of the placenta developing here on this side. Let's do the crown rump length.
Yeah.
So the first thing we do in a scan is we do a survey scan to find out the global anatomy. We have found there's a single fetus. Now see what you're doing is you're zooming the image as much as possible and measure the crown rump length. So the crown rump length is about 2.6 centimeters or 26 millimeters. So you can calculate the gestational age. Please tell me what the gestational age is.
8.6.
What is that? Yeah, 2.6. Calculate. I gave you the measurement. 9 weeks. Yeah, around 9 weeks.
6 days after LMP.
6.5 plus
10 weeks, 6 days of LMP. According to LMP, 9 weeks, 6 days.
9 weeks.
What?
2.6 weeks.
According to LMP, she 10 weeks.
6 days.
8 weeks.
10 weeks, 6 days.
Okay, 10 weeks, 6 days. So let's do the crown rump length measurement again. So you start to take the longest length there.
Yes sir.
Yeah.
Yeah.
Let's do the CRL again. We normally do 2 or 3 CRLs to make sure that we are
in the right plane.
That is giving a gestation age of 9 weeks and 4 days.
Yeah. So 9 weeks, 4 days, 2.8.
Yeah.
So 10 weeks, 3 days, the The difference is about?
About 1 week.
Yeah.
1 week plus 1 day.
Is she having regular cycles?
Nearly regular cycles.
Regular cycles.
Ah, that's nice.
So,
That's
we can, this is a baby which is actually sitting on the fence. You can choose to change the dates here, or you can choose to retain her date. We will wait for the 11-week scan and we will be able to see the fetus much better. So this is about 9 weeks, 4 days, 10 weeks, so it's quite all right.
Excuse me, sir.
Yes.
If we find bradycardia at this stage of less than 100, you said, what exactly should we be looking out for data?
Nothing. What we just do, we wait and
Less than
watch.
7?
We just wait and watch.
100 or less than 70?
We are a little concerned,
Bradycardia.
but I won't raise an alarm to the patient at this point. If it is less than 70, then I would certainly say I will see her back in a week's time. If it's less than 70, I'll call her back
Nice
in a week's
tracing.
time. If it is around 90 or so, I'll go for the 11-week scan straight away. She is asymptomatic. So I don't need to do anything in between. And whatever I do, I'm not going to do it. I'm just a passive watcher here. What about the events that are happening? Okay, can you zoom the, please do not, we don't need to use
Another thing,
outlook.
sir, suppose you find the sac is low down in a case of previous cesarean section,
Yeah.
and the chances of it being, it implanting on this scar are very high. I mean, this question is for even the seniors. Do we have any way of predicting whether it's going to be an accreta? Like, should we go for a termination, or should we like?
Well, if you go and intervene, the next time she's going to have the same risk, isn't it, or even more. So.
No, the point is, if we have a high prediction of accreta,
Now,
then we can save her probably.
Can mothers and babies with accreta be saved or no? If you have sufficient information prior, can mothers with accreta and babies with accreta, can they be saved or no? Large percentage of them. So there is no indication for termination of pregnancy. It's only to alert you saying that this event is likely to happen. Watch out for this pregnancy. That's all. Okay, now see the amount of zoom she has done, then we're able to get much better details. Okay, now at this stage, as I said, doing a transvaginal will give you much more information about the fetus. Okay. You probably can ask her to empty her bladder. So you can see the lymph buds moving there. Can you go back again? There. You can see the lymph buds which are moving there. So the upper limb is here, lower limb is here. And you can see the intracranial contents. The cleavage has just started. The brain cleavage has just started. Then we'll probably look at this transvaginally in a little more better fashion. The whole extent of the lower limb is seen out of this. Okay, right. Any other questions on?
Yes, in this, the omphals sometimes we see physiological. Suppose we see pulsations there.
Yeah, you will see pulsations there. Because the, can you switch on color please on that now? Can you switch on color? You will see, you are seeing the pulsation there. Now take out the color. Take out the color. See the pulsation there. You will always see pulsations there because that's where the umbilical cord is coming. The umbilical artery pulsation will be seen there through the umbilicus. So that's not wrong. That's sort of expected. Okay. So can we take her off now and then ask her to empty the bladder and come out? Yes. Is there an entity called early growth delay? Yes.
Early growth.
There is an entity called early growth delay, but that entity, proving that entity is the biggest nightmare. Okay. Now the thing is, the rule in early pregnancy is if the CRL does not correspond to gestational age, then you change it. Right? Now where I will get myself alerted, where I will not hesitate to change the dates, is in a patient with pre-gestational diabetes. And she comes in early pregnancy, uncontrolled pre-gestational diabetes. Then I do the CRL, it is not corresponding, she says I'm really sure of my dates. I will hesitate to change the dates because in pre-gestational diabetes, an early growth delay actually means a major structural abnormality which is going to develop later on. So if she is not a diabetic, then my first choice will go to changing the dates and then we will watch out.